Joining me now via Skype is public health specialist and CEO, MEDWAY Health Limited, Tuyi Mebawondu. Dr. Mebawondu, it's good to have you join us this morning. It's good to have you. Now, community transmission has been ongoing. In fact, that has been on the rise, and with the number of cases that are reported on daily basis. Now, NCDC, on the other hand, are explaining it that it is because they have capacity to test more people. That is why they're discovering these new numbers. But on the side of the people, it is increasing fears in them. And from what we hear, a lot of people are saying, we're hearing people are refusing to go for tests for the fear of it. Talk to us what you're hearing.
Thank you, Mike. Ramadan Kareem to all the Muslim faithful all over the country. Now, we are in a dark situation. On March 23rd this year, when Nigeria closed the land border, we had just 26 cases, and one discharge, 26 cases, no deaths. By the third day, when Nigeria was closing the air border, the airports and the major airports, the cases have doubled with one death. We were at 51. Today, after closure, after a month after the closure of the border, both land and air borders, we're having 981 cases, 31 deaths, and even overnight, 108 new infections. What else do you then need to prove that there's an ongoing serious community transmission? Look at the case of the Kano, for instance. It's become so embarrassing that even the governor said, listen, it seems I'm helpless. Kano just have just one center. That is Amadu, the teaching hospital that's taking care of just about 10 beds, ICU beds, and taking care of the whole northern part of Nigeria. All these cases came because we tested just less than 10,000, okay? That means that if we compare ourselves to other African countries, if we compare the number of testing we've done to other African countries, we are having a serious community transmission. From just 3 states in March 23rd, we're now in 27 states for Federal Capital Territory, with 3 epicenters: Lagos, Federal Capital Territory, and Kano. It's a very challenging situation. And this is why we were shouting at the initial point when we had just 3 cases that government should throw in all they can, that we should overreact. Because if we had overreacted, if we had thrown in all we can, we needn't shut down, we don't have to really shut down our economy if we had done that early enough. Now, the chicken has come home to roost. We are seeing numbers of health workers being infected increasing in a precarious situation where we have a huge gap in healthcare delivery system, where we don't have human resources, where the personal protective equipment are in short supply. So it's a big issue. And of course, the best we can still do is hang up there, stay home. Because why do we push for this stay home? Now, we're pushing for what you call a rapid decline, exponential decline in the number of infections. Now, let me create this scenario for you. If, for instance, we say that the infection rate of this jam is 2%, now what it means is that in a population, within 8 days, you will double your infection, and then within 40 days, more than half of the population will be infected. That is what we mean when we say that we have 2% infection rate. So what we are trying to do now is to push down the new infection, and that is why the essence of that stay at home, the essence of that social distancing and wearing face mask, washing your hands, becomes the cheapest and the most rational method to drive down the rate of infection in the country. If we don't do that, then we then have to be confronted with serious issue of how do we now deal with overload of cases. Now, project this thing forward in about a month, and you can now imagine what the numbers will be like.
Wow. That's okay. Well, let's leave it here for now, and then we certainly have to ponder on that for a little while for people to really understand the implication of things. Thank you very much, Dr. Tuyi Mebawondu, for your time on the program. Joining me now via Skype is public health specialist and CEO, MEDWAY Health Limited, Tuyi Mebawondu. Dr. Mebawondu, good morning and good to have you join us this morning. One of the stories,
Because,
one of the stories that is of great concern now are the health workers that are being infected with coronavirus. It was reported that about 40 of the health workers have been infected. About 9 doctors and 1 nurse so far in part of the country. Now, draw us to the realities of this. Now, the Minister of Health is saying that anyone who is caring, or those who are the caregivers, must put on the PPE. What is of great concern here? How scared should we be about this?
yeah, we should be quite concerned, because now, for the whole of the country, we have just, for doctors, about 40,000 doctors attending to 200 million people. The nurses are about just ×2 of that numbers, and then, of course, the pharmacists and the laboratory scientists are lower number. But because once you take away, a health worker when he has an infection with COVID, that means that you are compromising the number of people that can really access treatment, which is a big issue. Now, if you remember, during the Lassa fever in Kano State, recently, the doctors went on strike and said that, listen, government must provide for them the personal protective equipment to enable them perform their duties. So we've seen, actually the shortage, massive shortage of this personal protective equipment everywhere. The countries that used to supply us, that give these things to us, they are producing and using themselves. We've not been able to actually improvise or even create ones by tapping into our local industry where we can manufacture some or even make some. So the first and foremost, the challenge of personal protective equipment being sufficient and adequate is a key issue in this regard. Secondly, of course, we commenced the training a bit late, because what we were expecting was that as the thing was breaking in China, we would have then set up mechanisms to train and engage the few health workers we have and do triaging sufficiently to know who to bring in and then who to expose to the coronavirus as it is. Now, that we have failed. Now, even when it comes to the time the disease was coming around the world and people were still denying it in Nigeria, we didn't quite, start early enough the process of what I would call social isolation and social distancing. We didn't start enough, because if we had started enough, probably the need for us to close our economy may not have arisen. So we were still believing that the temperature would not affect us, that the blacks are protected. But we have seen the contrary now, that we've seen that when epidemic like this hits, it hits the poor first and hit them worst. Kano is a living example. Kano as an epicenter of this coronavirus will be a huge challenge for Nigeria and for even the health personnel. Because, Aminu Kano Teaching Hospital is the only place that can actually, cater for COVID challenges. How many ventilators? Barely 5 ventilators, catering for the whole of the northern part of Nigeria. And then now we are seeing, malnutrition, poverty, homelessness, overcrowding happening in Kano. We see the IDP challenge in the northeast. We've seen also cholera, another Lassa fever, endemic there. So it is a big challenge for us. So now the cheapest thing we can do right now is to stay at home, wash our hands, because if we don't do that, then we're not going to cut down the number of transmission. If we're not cutting down the number of transmission, for us to resume normality will be a huge challenge. It will be a huge challenge.
All right. We see that in Europe and parts of America, every day people come out to say thank you to health workers for what they're doing, for putting their lives on the line, being in the front line. A lot of people say that's a wonderful thing to do, certainly, but that is not enough. Now, bringing it to the reality of life insurance as well as hazard allowances that are meant to be given to them, how far away from that are we here in the country?
If you remember, even just before this COVID came up, or at the earlier stage, we've seen quite a number of medical doctors or health workers on strike. In fact, it took the intervention of the enemy president to say, everybody, go back to work. We have COVID on our hands. Now, it is nice for people to clap and appreciate doctors. We just hope that this thing continues not just doctors, other health workers. We just hope that this thing continues into the next stage after we might have defeated the COVID. The appreciation, the hand clapping may not be sufficient. We need to create a special incentives to not just to keep doctors, but to also encourage people to be part and parcel of training into the health workforce, because we are not having sufficient people, being recruited into the health workforce. We're not retaining them. We're not retraining them also. The attrition rate is very, very high. And every health worker in Nigeria now, their dream is to emigrate and go elsewhere. If we don't use this opportunity to address the health challenges we're facing in the country, then we may not have another opportunity, because it has become essential. Now the army of the future is not just the number of guns you have, it's the quality of your health workforce, it's how well you can provide food for people, it's how well you can respond to epidemics of this sort. So let us understand the changing dynamics of strength of any nation. If you don't embrace and engage in it, we will have missed it.
All right. Thank you very much, Dr. Tuyi Mebawondu, for your time on the program.